We're going to talk about fertility now and how it can be a major hurdle for couples wanting to start a family, plus the surprising link between exercise and infertility. Welcome back. This afternoon is Dr Tamara, and welcome to the show.
Hi, Em.
Now, we know that infertility is an issue that affects 1 in 6 couples, but more specifically, when does a couple have to consider they may have a fertility challenge?
Well, it's the great irony of life, Emmy, that we spend the vast majority of our reproductive years trying really hard not to conceive until we've got the house, the dog, the job that we want. And then when couples do start to try, as you said, 1 in 6 of them find it really difficult to conceive and often need help. When you look at a population of people, about 85% of couples, if they're having regular timed unprotected sexual intercourse, should have conceived after 12 months of trying, and in the next 6 months about half of that remaining 15% should be pregnant. So really by 18 months of trying, about 95% of couples should have conceived.
So are there some statistics on who is most at risk of suffering infertility?
Well, we know that it's definitely commensurate or correlated with a woman's age. We know that as a woman gets older, the chances of conception do reduce. When you're looking at a population of women over the age of 37, every year after that, their chances of conceiving actually halve and their miscarriage rates significantly increase. Now, we won't leave the bloke out of it. We do care about his fertility after the age of 40. We know that sperm quality actually does go down after 40. So the perfect storm, in fact, is a couple trying for the first time and they're both over 40.
Okay. Well, let's talk about exercise and fertility and how someone who's very fit could surprisingly have trouble conceiving.
Right. So we know that moderate level exercise is really important, particularly for overweight couples. We know that being overweight does significantly reduce your chances of conceiving in both a man or a woman. But when you are of normal body weight, or even a woman who is underweight, if they're undertaking high intensity activity, it can actually compromise their chances of conceiving. And that can be the frequency of exercise that they do, the intensity that they undertake, even the duration of exercise that they're doing can significantly reduce their chances of conceiving.
So just to quickly recap, Dr Tamara, what are the top 4 things a couple needs to consider when they're trying for a baby?
So I think number 1 is, for a woman, know your cycle. There are some fantastic kits that you can get from your pharmacy to help you know when you're releasing an egg. So that's really important time in trying to conceive. Live your life in moderation. Don't go overboard. Get plenty of sleep, eat well, definitely don't stress because that's only going to add to the problem. And my number 1 tip is make sure that you're getting folic acid. We know that that is the number 1 supplement that is really important in the periconceptual period of time. So making sure you've got folic acid in place before you start trying.
Okay, perfect. Dr Tamara, I always love your advice. Thanks very much this afternoon.
Thanks, Emmy.